Today, we are focusing on health and well-being, which is exactly what Dameron Hospital takes pride in. Dameron Hospital's commitment towards providing quality care has earned them recognition nationwide, all under the current leadership of President and CEO Lorraine Auerbach. In fact, I sat down and talked with Lorraine about Dameron Hospital's partnership with Stanford Healthcare and the Stanford University School of Medicine. They've established a joint cardiothoracic surgery program with Stanford medicine physicians that is now available to residents of Stockton and the surrounding areas. So tell us how Dameron Hospital and Stanford came together in a partnership.
Started a number of years ago around our stroke program, and Stanford, as many of you know, is one of the leading edge centers for stroke care and for cardiovascular care. So we explored around stroke and brought that service line and the higher level of care associated with it to our local community, and thought we need to take this another step and look at cardiothoracic surgery and move in that direction. But this time we did a little bit differently. We brought Stanford to us. So the partnership became faculty of Stanford who work at Dameron Hospital full-time in our community so that people don't have to leave the community for their care.
All right, and so that in itself is a huge benefit, but explain a little further how this benefits the community of Stockton.
Well, you know, again, people don't have to leave when they feel they have something very complex or that really needs something leading edge to be treated. So they can then select one of our local physicians who really is a full-time Stanford faculty member based at Dameron Hospital to be able to provide that care. So rather than leaving, we brought Stanford to us.
Right, and then tell me, what is your vision then for Dameron?
My vision for Dameron is to continue down this path and bring excellence to our community, bring higher levels of care that people have to leave for now, and make that a part of who we are and what we do. And I think the benefit to the community is huge.
Here with us is the medical director of the Stanford Cardiac Surgery Program at Dameron Hospital, Dr. Eric Kaiser, to discuss the benefits this new program brings to the community. So, Dr. Kaiser, what inspired you to get in the field as a cardiac surgeon?
Well, I've always wanted to be a doctor since I was very young, and I was always very good with my hands, very good with my fingers, painting, creating models, that sort of thing. And I always had great grades in school. So it seemed like a natural fit moving forward. But then when I was older, my mother became ill with severe heart and lung disease. She had severe emphysema of the lungs, and it was so bad that it made her heart swell, and she developed heart failure. And at one point in my teens, she was provided the option to have a heart-lung transplantation. But back in that day, the success rate of that operation was so poor that she decided to turn down the option for heart-lung transplantation. I didn't know it at the time, but I'm quite sure that further on down the road, that inspired me to become a heart and lung surgeon.
And tell us about the patients that you treat now. What are their symptoms? What's their experience like?
The patients that I treat are adults with heart and lung disease. Often they experience chest pain or shortness of breath. Sometimes they experience no symptoms at all, particularly those with diabetes. In that context, sometimes heart disease can be the silent killer.
But now Stanford and Dameron have partnered to bring amazing care here to the Stockton area, to San Joaquin County. Tell me, how is Stanford and Dameron such the perfect match?
Well, both hospitals have a shared philosophy of excellence and providing outstanding outcomes to the local community. So Stanford, of course, is world-renowned for, over the decades, breakthrough techniques in heart disease and in heart surgery. And so in this partnership with Dameron, we will be able to bring that level of care now to Stockton.
So what are some of the new treatments now for cardiovascular disease?
So here at Dameron, with the Stanford partnership, we're now able to offer beating heart surgery for complex multi-vessel coronary disease, minimally invasive valve surgery for complex valve disease. We have heart failure support devices for patients who have limited heart function. We are able to offer surgery for cardiac arrhythmias, surgery for the great vessels, as well as minimally invasive lung surgery that wasn't being offered before.
All right, and tell us some of the successes that you've seen so far.
So the program is still young, but so far we have successfully treated several patients with multivessel coronary disease using a beating heart technique with terrific outcomes, including patients who have heart failure. We have done complex mitral valve repair and minimally invasive lung surgery, and we're only just beginning.
And Dr. Kaiser, where can people go to find out more about their options here at Dameron Hospital?
I recommend they speak with their physician, their cardiologist, or they could visit DameronHeartSurgery.com.